what does emotional fitness look like?
Excellent. Why should I fix your heart when you come with a heart attack? Why should I save your life when you come with a stroke? Why should I intervene in an emergency situation, make sure you walk again? Why? So now you have a higher purpose, whatever it is.
Hello, guys, and welcome to the Just to Kick It is a Blessing podcast. Welcome to the podcast where it's all about time, where we teach, inspire, motivate, and entertain through the art of storytelling. Today is a special episode, and I have two guests who are going to be coming for the men's conference this year. But even before I introduce my guests, I'd like to tell you guys something special. So for the month of November, to celebrate men, Just to Kick It is a Blessing has partnered with Karen Hospital to run a couple of tests for men. So we have prostate tests, the PCA and the prostate ultrasound at discounted rates, and we also have heart tests, your ECG and echocardiogram. In addition to all that, we have other free tests, including BMI, physical examination, temperature, and other tests. So please, 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 guys, take time to visit the Karen Hospital this November and get your heart and prostate checked. Without further ado, I will let my guests introduce themselves.
Yes, hello Tupac.
Thanks.
My name is Dr. Tayo Opankunle. I'm a internal medicine resident, or I'm specializing in internal medicine. I'm also a content creator and a voiceover artist. And it's very wonderful to be here on the podcast today.
Thank you, thank you.
Yeah, thank you, Tupac. My name is Dr. Musila Nzioki. I'm an internal medicine specialist, or what you'd call a physician, and I work for the Karen Hospital, and I'm glad to be here.
Yeah. I think even before we dive into the podcast, I saw on both your thing internal medicine doctor or internal. What does that mean?
So internal medicine is a specialty in medicine.
Okay.
The same way you can have an obstetrician and gynecologist, a pediatrician, a surgeon.
Yeah.
So an internal medicine doctor is a doctor who deals with non-surgical diseases of adults. So that's and we especially specialize in chronic medical illnesses. So think about things like diabetes, hypertension. We treat things like asthma. We treat things like serious infections. That's kind of what internal medicine is about.
Okay. Yeah. So if there was one thing, or if even one line, you could explain something you wish men, especially Kenyans, knew about health, what would it be?
What I'd say is one thing is that a lot of the things that eat people, let me use that word, are actually silent. Think about just the most prevalent of these chronic diseases, hypertension. At the moment, it's estimated that about a third of people are hypertensive globally. And that number goes up to above 50% for people who are above 50 years of age. So this is a silent disease. Many times you don't even have any symptom. You don't have a headache. You don't have any, so half of the people above 60 are hypertensive. Half of those who are hypertensive don't know that they have it. Half of those who know are not on treatment. Half of those who are on treatment are not controlled. So that's called the rule of halves. So that is how severe this pandemic is, because it's so prevalent and yet many times it is symptomless.
Yeah.
Yeah, so I would say that that awareness needs to go out there, so that as you go out for a checkup, you can insist on knowing your heart, your blood pressure, and do something about it.
For me, what I'd like to say is that I think it's important to change the narrative that we have around hospitals.
Okay.
That a hospital shouldn't be looked at as a place where you go when you're sick. I mean, of course, that's primarily what it's there for.
Yeah.
But I think we should also add in the fact that a hospital should also be a place that you go still when you're healthy,
Yeah.
or also to maintain your health. Yes. And I think if we look at hospitals as places where you can go to maintain your health,
Yeah.
that shouldn't make them as scary as a lot of people tend to think they can be.
Because when I look at it and I look at my stories, wow. First of all, I thank God for what I assume is good health, because I don't think I've been to a hospital in a minute. But what's the risk in that assumption that I have that, okay, look, Tupac, you exercise, you take your supplements, and you do all these other things that believe is healthy to your body, but you never go for checkups. What's the risk in that? Because I believe I'm thinking like maybe almost 80% of the other men.
So as Dr. Musila had mentioned, is that even though you're taking certain steps to maintain your health, you eat well, you exercise on a regular basis, you're taking care of your mental health, it's important that you regularly screen for certain conditions,
Yeah.
which might stay silent for a long period of time until eventually they stop being silent. And one of the key things to really look at with regards to that is your family history.
Okay.
So even though you might be maintaining very good health,
Yeah.
if you have a family history of hypertension, if you have a family history of diabetes or of any kind of cancer, usually the age we like using is 40. So even though you might be partaking in activities that do keep you very healthy, it's very important still to still screen for these illnesses, because they might not have any symptoms even though you feel perfectly well, until eventually they do show up.
Yeah. So you're saying 40 is
40 is
that
usually
age?
the yes, yeah.
Actually, to add on to that,
Yeah.
I mean, I've attended quite a number of funerals,
Yeah.
and that's something that keeps coming up in many funerals, that this person has enjoyed good health. He's never visited a hospital until one day they drop dead.
Unfortunately.
Unfortunately, and it is usually said as a compliment or as a good thing that this person has never visited a hospital. Could be that if they had visited a hospital,
You could have
whatever
seen.
killed them would have been picked, and we wouldn't be gathered here today. Yeah, so it is important to go to the hospital even when you're not feeling ill,
Yeah.
just for a checkup.
So when you look at it, of course, maybe other than hypertension, which I've seen you've both mentioned quite a lot in the brief conversation we've had, what other issues are you seeing that really face men between about 25 onwards?
So one of the things which is definitely increasing in prevalence is mental health issues.
Okay.
Anxiety, depression, and especially also still in younger men is also something known as schizophrenia. Yes, we're seeing quite marked increases in these conditions. And what tends to happen with these conditions is that the symptoms that they cause can lead to ways in which people who are suffering from these illnesses try to cope with it. So for example, let's for example with alcohol. So a lot of people who take a lot of or excessive amounts of alcohol, it usually tends to be because they're trying to do what we call self-medication.
Yeah.
So they might be suffering from anxiety or depression, but when they take alcohol, their symptoms reduce. They actually feel okay, they feel normal. And so then they tend to think that, okay, if I keep taking alcohol, I won't be feeling the way that I do. Yes, but then the alcohol then leads to other issues, which then can make the mental health worse, and it can be such a vicious cycle, especially at younger ages.
Yeah, I've had people, including me, saying, "Yo, when I'm sober, I'm shy, but once I take a few shots, that liquor confidence comes in."
Yes, yeah. Alcohol, though, it's
It's a balance. Yeah.
it's some people call it a social lubricant.
Yeah.
Yes, it makes interactions with other people a lot easier. You're not as shy, you can. Well, that's partly because of what alcohol does,
Yeah.
is because it inhibits the area of the brain that tells you not to do certain things. So it's a lot easier to go ahead and do certain things, such as go up and talk to somebody and be more confident, etc.
Okay.
Yeah.
But we don't recommend.
Yes.
Yeah. No.
Yes,
That's
we do
okay.
not. Yes.
When you look at it, why do you think those things are becoming more common? You know, because for me, I believe that if something's growing, there's a reason it has to be growing. So for you guys, in your own opinion, why do you think those kind of things are becoming a lot, more common?
Yeah, I mean, on the aspect of, I mean, mental health, definitely. Uh, Mental health, you have to look at it from the perspective, I mean, from the points of view of genetics as well as environmental contributors. And there's nothing you can do about genetics, but environmental factors or triggers that can bring it to light. I mean, there's a lot of disillusionment in our society today, uh, and especially in the developing countries. Actually, it's globally, even in the developed world, but I think more so those stressors tend to affect the developing economies a lot more.
Yeah.
Jobs, you finish education, you don't have a job, you don't have access to, there are a lot of imbalance in society, a lot of basically stressors, uh, whether it's the political space or whether it's at home, whether, there are a lot of things that are pushing, especially young people, into this disillusioned space. Also, social media, where you want to, you think that you ought to be at a certain level in life, and it turns out not to be as you imagined it would be. Yeah, so that fallacy, that so there's a lot that pushes people to that space of depression and anxiety, and yeah, it's something we ought to discuss head on, and especially men. I think women are sort of they open up to each other a lot more readily than men do. So it's a challenge that I'm imagining all the social stressors and that are out there are really driving it. When you talk about cardiovascular diseases as a whole, that's now another aspect that's also changing. Before, we used to, when I was training in medical school, we used to see a lot of infectious diseases. HIV was big. Tuberculosis, it's still big and it's still an issue, and it's still something that young people ought to also, you need to know your HIV status. Uh, uh, but that prevalence has been going down thanks to effective interventions, ARVs, and awareness and all that. But we have seen since the turn of the century or the millennium, we have seen non-communicable diseases overtaking infectious diseases. And of course, now that one again is being led a lot by lifestyles. We are not exercising as much as we should. We are not eating as well as we should. And the more reason why we need to go out and, go for a checkup and see, see what could be going on silently in our bodies before it's too late.
Yeah. I think one of the things that you said even made me think of something, and it's this debate that I keep on having with my friends. So it's good that I have now two doctors here to answer it. And we keep on having this thing is when it in regards to mental health, yeah, when I look at the numbers, I think it's in Kenya it's 8 out of 10 suicides committed are by men. In the world, I think it's an average of 7, which is still a crazy number. Does that show mentally that as men we might be the weaker sex? I know it's a crazy question to ask, but that's the kind of questions we like to ask here.
Yeah. Um, Yeah, that is in terms of in terms of those statistics, because what actually tends to happen, well, for starters, it's very important that I say if anybody is thinking about either ending their life or they're going through very very difficult circumstances,
Yep.
that they should seek
Help.
psychological support.
Yeah.
Either initially confiding in family members, but more so actually going for counseling or to see a psychiatrist to help with that.
Yeah.
Yes. With regards to those statistics, unfortunately, what we do see is that men tend to be more successful with their suicide attempts because they tend to use more violent means, whereas women, they attempt suicide more frequently than men do, but are not as successful, and that usually is as a result of it's a cry for help is what it is, to say, hey, I'm going through something really difficult right now, and it's something which for me it's too much to handle, is the thing. And at that point, that's when it's extremely important to seek psychiatric support.
Yeah.
Yeah.
The mental health specialists call it parasuicide. So parasuicide is more common in women, whereas suicide is more common in men. So men, when they commit to commit suicide, yeah, they will most likely be successful. But parasuicide, which is mostly, as Doc says, a cry for help, a cry for attention, yeah, women, attempt it more, than real suicide. And it's not an easy thing. Suicide, I mean, it's for the people who have been affected by that, is not an easy thing, both for the family and also for the sufferers of these mental health diseases. And we should know, of course, they are diseases just like other diseases. Yeah, it's so, and yet they tend to be stigmatized a lot, and people tend to keep quiet and shy from going and to the hospital for help, and so it's important that we talk more about it.
Yes.
And we address the topic more. To answer your question, yes, I think in that case, men are the weaker sex. Yes, and in that respect, really, because do we define courage as, we tend to define courage as killing the lion. Yeah, killing, becoming the CEO, becoming the president. That's success. That is that is our measure of success. I mean, for a man to kill a lion is easy, but the greatest courage, according to me, is beating yourself, being able to overcome the things that keep you from doing the right thing. And this cuts across all aspects. If it is, for example, maintaining a good shape, maintaining a healthy weight, being able to wake up in the morning against your body's wishes of, staying tucked in. If it is avoiding that chips, that pizza, that soda, if it is exercising, you have to really defeat yourself. And that reminds me of, I think it's Mangu High School.
Yeah.
Mangu High School, correct me if I'm wrong, but I think their motto is Jishinde Ushinde. And that really, really inspires me. You have to defeat yourself for you to attain whatever goal. You have to shinda yourself for you to shinda whatever it is. Whether it's, yes, for those of us who are religious, I'm a Christian. So if Jesus says I stop sinning and pick up his cross, then start stopping sinning, that fighting against your body. You have to, that defeating yourself. I think women tend to do it a lot better and easier than men do. If it is stopping an illicit relationship, for example, I mean, if you're cheating on your partner, your spouse, stopping that, you have to beat yourself. And that's, I think, tougher than killing a lion. And that's really, to me, the best definition of courage. And it's only after we can beat ourselves, we defeat ourselves, that we can attain what then lies beyond that sacrifice. So jishinde ushinde.
I agree with that. I think a lot of us struggle with the journey inward. The journey outward, we really succeed at it, because there's not much beating yourself you do. But the journey inward is the one that's scary, it's nasty, there's the good and the bad that we all shy away from. And even to talk about that mental thing about the women and men, I saw it on average. There's a study that was done. I'm not too sure how accurate it was, but based on the group that they studied, they said it takes on average about less time, like 3 times less time for a woman to forget about a man than for a man to forget about a woman. Because immediately she feels like everything's gone wrong, she'll deal with it, but you'll never deal with it. You'll keep now all those negative vices that you talk about. And then eventually it's now 8 months, a year on later, is when you're actually sitting to deal with that problem. Yeah. But again, to maybe when we look at non-negotiable, like checkups, so if a man is 25 to about 30, and then 30 to 40, and then 40 and above, what are non-negotiable checkups he should have in his annually?
Okay. For the age range from about 25 to 35,
Yeah.
just a basic checkup is okay. So something like just checking your blood levels, your hemoglobin, your white blood cell count, your platelets, making sure some very key hormones like your thyroid is functioning well. And then, because usually the reason we don't stress too much about checkups in that age range is because, as I had mentioned earlier, the body really starts having issues maintaining itself from the age of 40 onwards. But from that age, from 0 to 40, the body does a great job of maintaining its normal everyday functioning. Because age hasn't started to impact the way the body functions as much by that age. And so actually, more so what we would stress within that age range is a healthy lifestyle. For example, the heart attack that happens at 50 did not just happen at 50. It started at 25 by smoking, by eating too much processed food or fast food, by not exercising, by working very stressful hours, by not sleeping very well. And so, as much as checkups at that age are important, there are not too many diseases that we'd be able to screen for and find successfully at that age. But I would say a healthy lifestyle is very, very important from a young age going forward. Yeah.
Yeah, and to me, I think that's pretty correct. Majority of the young people in that age, the body is pretty strong and taking care of itself. But it's also important to pick. At this point is where it's really important to sit in front of a doctor, because a doctor might be able to pick something that something that you might not be aware of just through an examination, through an interview. Your doctor might be able to pick something which, wouldn't define everybody within your age range, but we know there are outliers. For example, we know there are people who get cancers at a younger age. There are people who get heart attacks at a younger age. There are people who get hypertension at a younger age, diabetes, all those things. So, and then again, mental health. There are people who might be going through mental health challenges at a young age. And as you said, a lot of us are, So just sitting with a doctor, getting your blood pressure checked. Of course, before you see the doctor, the nurse has done the blood pressure. He's taken the weight, the BMI, all those things. And right there, those are possible avenues for intervention. through examination, the doctor might pick something that might need further investigations. But to me, if the non-negotiable at that age, I think, is just getting your HIV test checked, and of course, I would say, and we don't do this. Many hospitals don't do this, but mental health examination, a mental health assessment. I think we ought to be screening for mental health diseases, even at a checkup level, as much as we do for physical diseases, organic diseases. Because I think at that age, a lot of mental health is there's a lot of mental health challenges going on, and these don't get addressed, and this spills over to your family, your spouse, your children, and by the time by the time it really comes to the fore, it's too late to do anything about. Yes, so I would say at the age of 25, get your mental health assessed, and maybe get a HIV test. Yeah,
So that's 25 to, you said 40.
yeah,
So
yeah.
above 40, what are now the tests that are non-negotiable? Because you're saying
yeah.
that's when a lot of these diseases happen in a person's body.
Exactly. So cardiovascular now becomes really key.
Okay.
Echocardiogram, ECG, a treadmill test, your cholesterols, your kidney function, your liver function, cancer testing, prostate, PSA. You should start testing it probably from that age.
Okay.
That being the commonest cancer among men.
Yeah.
On the female side, maybe we can just maybe you can just allow me to talk about the female a little bit. Yeah. For ladies, of course, your pap smear, and that should start from a much younger age, from your 20s. Your pap smear, your breast examination for the younger ones, breast examination by a doctor at least once every year. A breast ultrasound suffices. Above the age of 40 or beyond, not every year, at least a mammogram. Because of that, the top 2 cancers affecting women in Kenya. For men, now let's come back to men. Prostate cancer is the number 1. So a PSA is important every year from the age of 40. The number 2 is esophageal cancer among men. So again, that just follows that then that should be screened from an early age, probably from around 40. What is the best way to screen for esophageal cancer is an endoscopy. And that is really the only way you can catch it at a very early age. At a very early stage. Countries like Japan, they're able to pick these because the screening is so robust. Yeah. They're able to pick the cancer when it's very tiny, that you don't need surgery to treat it. It can be resected endoscopically. Yeah. So we need to get to that point, and we are talking about the number 2 cancer among men in Kenya. Many people call it throat cancer. So there is a throat cancer, yes, that occurs in smokers, but this is not throat cancer. Although when you hear someone say, yeah, someone had throat cancer, it's actually esophageal cancer. Okay. And by the time it's diagnosed clinically, when you're not able to swallow, it's too late. Okay. Yeah, so endoscopy from the age of 40 and colonoscopy, because colonoscopy also we are talking of maybe the number. If you don't, there's a Kaposi sarcoma, I think, is commoner, especially in HIV. But outside HIV, colon cancer comes a close number 4 after KS. So endoscopy and colonoscopy can solve those 2 problems. And after that, you can do it maybe every 5 to 10 years, unless there's a real risk factor that maybe your doctor wants you to do it more frequently. Yeah. Other than that, the simple test to screen, because you might not be able to do endoscopy for everybody. Just a stool test, for blood in the stool, that can screen people who might need to prioritize their endoscopy and colonoscopy. So, yeah.
And then one other test I wanted to actually add on top of screening for hypertension, diabetes, different cancers. Another thing which disproportionately affects men a lot more than women is gout. And the reason why this is important is because a lot of the times what we'll end up seeing is somebody will somebody will complain of it. Gout is very interesting because it has a very classic presentation the first time it occurs. It usually affects the big toe on somebody's foot,
Okay.
is the thing. So what will happen is somebody will get a swollen, very painful, tender, it's at one of the joints of the big toe.
Yeah.
And then what they find is that they then take a specific kind of painkiller known as an NSAID, something like diclofenac, aceclofenac, something like that.
Yeah.
And it relieves the pain. And so then what happens is they keep getting recurrent episodes of this pain on their toe, or it can happen in other areas of the body. It usually first shows up in the toe. And what happens is they keep taking these painkillers.
Yeah.
And the issue, even though these NSAIDs or non-steroidal anti-inflammatory drugs, they're great painkillers. But the problem is that they should not be taken for prolonged periods of time, principally because they can affect the kidneys and they also affect the stomach. So what will happen is a man will come to for example, the emergency department complaining of that pain in his toe. We check his kidney function and we find his kidneys are not working very well because he tells us he's been taking this painkiller all the time whenever he feels this pain.
Yeah.
Yeah. So gout is another important condition
check.
to screen for on top of all of those other ones.
Okay.
Actually, that's very important.
Yeah.
Because a lot of people on dialysis today, it's what the story that Dr. has just said. That is a sad
Thing.
thing. Yeah.
Yeah.
You guys have mentioned a number of tests. You've mentioned a couple of tests. But let's say there's a man listening to this and he can only afford 2 tests a year. What are the 2 tests you're telling him? Look here, you got to take these ones.
I would say, first of all, go to the doctor. Discuss. From the history and examination, the doctor will be able to pick what works for you.
Okay.
Because it's many times it's not one glove fitting all.
All right.
There might be, I might recommend a test based upon what you've told me. For example, if you tell me you smoke a packet every day, you've been doing that for the last 10 years, I might prioritize, screening for lung cancer, for example, or heart disease, or, this and that. If you tell me that you have a strong family history of diabetes and I can see you have the habitus to predispose you to it, I would screen for the sugar first. But I think if you want maybe a test where one glove fits all for a person above 40, other than the blood pressure, because you don't pay for the blood pressure, BMI, you don't pay for all that, I would prioritize, say, maybe a sugar test. It costs, many places it costs 200, 300. A PSA, many times it doesn't cost a lot. And maybe an EKG for the heart, especially if you have elevated blood pressure to begin with, or things like that, to screen for heart disease.
Okay.
Yeah. No, I completely agree.
For younger people, maybe I would want you to know your HIV status.
Yes.
And I would want you to be in your right mental health status.
Yeah.
Yeah, because a lot of us don't know ourselves many times until it's too late. Yeah.
And I think one thing that's always very devastating to see is when we make a diagnosis of something like high blood pressure for the first time, when a man is coming in after having a heart attack, is unfortunately a lot of the times how we actually find out that, oh, this gentleman has had high blood pressure for 10, 20 years that wasn't treated or diagnosed. Yeah.
Yeah. You talked about the toe thing and, how that's a sign of something and we always are ignoring these signs. What are other signs you see men ignoring that could be indicating, hey, brother, get yourself checked?
Okay, that's a very good question. With regards to cardiovascular health, it usually has a very classical, what we call a natural history in terms of how it progresses. So one of the biggest telltale signs that something is going on with the heart that we need to pay attention to is something known as angina. And what this is if somebody, if someone is, let's say they walk a short distance, maybe 100, 200 meters, they walk up a flight of stairs, or even before it gets to that point, let's say they go for a run and they start to feel this very heavy, crushing chest pain in the center of their chest. That usually is a very strong indicator that something is going on with the heart.
Okay.
Because what the heart is very interesting in the sense that when it's not getting as much blood as it should, because something is blocking the blood vessels, is what we call coronary artery disease.
Yeah.
The heart complains with pain. Yes. And what tends to happen, so for example, when somebody has had a heart attack, one of the blood vessels for that supplies the heart with blood has either completely blocked or is 80 to 90 to 100% blocked. Yes. But what these individuals usually tell us is that for a long period of time, they would walk up the stairs and they would feel that pain. They sit down, they rest, the pain goes away. So if that is happening, that is at that point, a heart attack can actually be prevented. Because we can go and we can do all sorts of different tests to evaluate how the heart is functioning, and actually address what's going on before somebody then eventually has a heart attack. Yes.
Very true. Very true. Yeah, I'd agree with that. Maybe just to add on to that, just as we said, with something as simple as a tape measure, a weighing scale, a height measure, you can you can actually tell which of these people might eventually end up having a heart attack, a stroke, blood pressure. I mean, these are seemingly simple tests where you don't need to pay anything other than maybe just showing up. If you measure your circumference around your tummy and around your hips, and if the tummy circumference is bigger than the hips, which is most of us, then that is a sign that we are walking down a slippery slope. Again, BMI, if it's more than 25, in other maybe our brothers from Asia, maybe if it's more than 23, again, that's a sign that you're walking down a slippery slope. If your blood pressure is elevated, you were told your blood pressure is a bit elevated, and you don't do nothing about it. Again, you're walking down a slippery slope. The dramatic things like maybe seeing blood, for example, in the urine, you'll run to the hospital.
Yeah.
Or pain or something, or a swelling. Yeah, but these are the things. So those you may not be able to ignore. But just the weight, lifestyle, you're smoking, you're not exercising, you're eating junk, you're not watching your appropriate weight, and we tend to ignore these ones, and many times they come back to bite us.
Yeah. So when I look at it, I think it's even as something that you said is, for men, those kind of things is a sign of weakness. So how do we shift, or what can we tell men to shift that ideation that, look here, it's not a sign of weakness, it's wisdom actually. Because you said a lot of free things that someone can actually get checked that a lot of us don't know. I personally seated here don't know. And I know that also covers for like 80% of men. So how do we shift that from a sign of weakness to some wisdom? Just the same way, when your car has that check thing, when it reaches that certain kilometers, how do we build that culture, especially amongst men?
I think we really, as men, need to. We really need to know. We need to understand ourselves first of all as emotionally. We need to know our emotions, which is something I was never taught in school. Maybe Taya, you were taught in your time. Do we know our emotional health? Do we know how to manage emotions? Do we know how to label emotions? Do we know how to manage anger? Do we know how to? And these are things I believe now are in our syllabus. I know that because I was listening to radio, KBC radio, another time, and I heard the radio teachers talking about this. So I know it's things that kids, at least nowadays, are taught. I don't know to what extent, but it's a positive thing. When I was growing up, I was never taught about dealing with my emotions and dealing with anger and labeling emotions, empathy, all those things. And that is something which, as men, we can be conscious. We can consciously seek to learn about that aspect of ourselves that we have zero knowledge about. And that has got everything to do with how we do things and how we how we live as successful husbands, successful fathers, and leaders in the industry and all that. So we really need to, either through reading the right books, being mentored, being coached, seeing therapists, again, just checking yourself in to your therapist and saying, I just want a checkup, a mental health checkup, and just, and be told that, yeah, you have a clean bill of health. Not to wait until you have a breakdown or a crisis. So just that understanding of who we are, on that, I would say, a blind spot in our lives, the emotional part. I think that's really, really important. And it's something that we must do as men, to really understand our emotions better and how to manage them, and to understand how they impact other people, both negatively or positively. And it's not to say that men are bad people. We're not bad people.
Yeah.
It's just that we are ignorant on these aspects. So how do we how do we erase that ignorance? We have to read books. We have to be coached. We have to be mentored. We have to listen to the right podcasts. We have to, we have to visit the professionals. And not only when there's a crisis, but when we feel we are okay, as part of our annual general, I would suggest.
Just the same way you take your car to the garage or for a car wash.
Absolutely.
Take yourself to the hospital.
Exactly.
And I was in terms of thinking about this question, like, I think if just in terms of the mindset that we have towards taking care of our health as men, and I think a good example would be, for example, thinking of our health as an investment. So it's taking care of our health as an investment is something which it saves you money in the future, is the thing. So that annual checkup that costs, I don't know, 5, 10, 15,000 shillings, doing that yearly, and catching something very early and actually managing it so that it doesn't cause a catastrophic event later on in life, is much cheaper than, for example, coming with a heart attack, and then now you need to need to go to a place like the Karen Hospital for your arteries to be unblocked, and that procedure costs you over 1 million shillings.
Yeah.
And then you then have to be on lifelong medication. Who knows how that event might have affected your health? And then I think, even, I know as men we can be very prideful, and I think, as much as pride can lead to a downfall, I think if we look at it in the sense that, okay, if we take pride in being providers and protectors for our families, what if maintaining our health so that we can do that for as long as possible is something then we can take pride in? So I think if we shift how we look at health, rather than being afraid of hospitals, I don't want to get sick, etc., to let me take charge of my health so that I can prevent things from happening, so that I can be as healthy as possible for as long as possible, then I think that to me sounds like wisdom, actually.
Yeah.
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 Another thing that that I see affects a lot of us is stress. So how is stress really? We say, oh, I'm stressed, oh, I'm stressed, but I don't think we really understand what that means. So from you guys, how is stress really affecting us, especially as men?
Yeah. Well, stress, both directly, indirectly. Directly, when you're stressed, your body produces stress hormones, what we call counter-regulatory hormones, chief of which is cortisol. That will give you diabetes. That will cause inflammation, lead to heart disease, hypertension. So directly stress can actually can give you blood sugar. It will directly cause pathology. Indirectly, people tend to deal with stress through destructive, be coping mechanisms like alcohol, drugs, sex, so whichever way you look at it, stress is not good. So it is better but then again, you might not be able to avoid the circumstances that stress you, but you must be able to cope with it in a healthy fashion. And this is where we are saying there are people and professionals who can sit with you and assist you to cope with your stress in a healthy way. If you come to the hospital, like the current hospital, we have all these specialists. And if you come to your physician, we can guide you. And if we think we need help of a certain subspecialty, we can guide you to them. So stress is not good. It needs to be dealt with, but in a healthy way.
Yeah, just to echo on what Dr. Musila said, I think the behavioral changes that stress can lead to is what then leads to a lot of these issues. And a lot of one of the risk factors for a lot of these non-communicable diseases is actually stress. Because indeed, if we don't find healthy ways to deal with the everyday stressors that are just present in life, that then creates even more stress as a result of what that stress has caused. Yeah, so it's very, very important just to know how to manage stress through things like I think a very big one for men especially is exercise.
Okay.
In terms of providing a physical outlet for that stress. Then certain mindfulness practices, such as either deep breathing, journaling, speaking to somebody who you trust, or going to speak to a therapist. Because if stress overwhelms us in such a way, the ways in which we cope will then cause more problems. Yeah.
And just to add, therapists are there. They've been trained. And the sole purpose why they went to school is to be able to help people with stress and other, such kinds of challenges. And they're there.
Yeah.
They're there in all hospitals. And that's really what they've gone to school to do. They have PhDs, and and they are there waiting for you to come. And I don't think that even the little bit of stress that you have is too little for that therapist to handle. We've said that even if you're not feeling any, as though you have any mental health challenges, just showing up and saying, "Give me a checkup."
Yeah.
We go through a mini mental exam, and you are given a clean bill. That's a good habit to adopt. Yeah.
I know a couple of people right now are probably between the age of 25 to about 40, and they're saying, "Look, Tupac, I'm too busy to do a lot of things. I'm always on the move. I'm always on the run. I have no time to myself." So for someone like that, what would like a 15-minute health routine look like?
I think it's interesting because indeed, if you do just carve out 15 minutes for yourself just to take care of your health, it's interesting how small changes can lead to very big changes, essentially. So something like that would be ideally. I would really love to say that whole 15 minutes, 15 minutes is not enough, even with regards to exercise.
Yeah.
But something as simple as a good brisk walk, just to get your heart rate up, you sweat a little bit. If that is done every day, that will go wonders with regards to just managing stress, with regards to keeping your cardiovascular health up. Exercise is great for regulating your blood sugar. But then, of course, if we're to include other things, it would be to stay very well hydrated, and then to make like just so 15 minutes. Unfortunately, is not enough time because any of these activities, like cooking a good quality meal for yourself that's not full of a lot of processed food, to a session of journaling or speaking to somebody who you trust or who you find good counsel in, to then exercising. Because, like, for example, we usually recommend okay, yeah, we usually recommend that, for example, like patients who have diabetes, we recommend that they do at least 150 minutes of moderate intensity cardiovascular exercise in a week. So 150 minutes, I mean, okay, that would be almost what, 30?
Half an hour every day.
Yeah, half an hour every day. So 15 minutes. If you could change it to a 30-minute health
Yeah.
habit, that would really make a difference.
So tell those guys to stop being busy and find like another extra 15 minutes.
Oh yes, oh yes, oh yes. And it's
Yeah.
not just walking, it's brisk walking. You have to break a sweat.
Yes.
Okay. Makes sense. I usually see this Korean guy at the golf club, like he's plays golf so interestingly. He'll just hit it. So even you, by the time he's hitting his second shot, he's left you so far behind, and you're wondering, then I get for him it's exercise. It's not the golf itself.
Exactly. He knows what he wants out of the golf.
Yeah. There's another common thing is, food or supplements. So where should men invest their money first and effort? Is it the food or the supplements? Because I know people who eat very unhealthy, but their cupboards are full of
Full of
the supplements.
So magnesiums and B12.
Yeah.
Well, the supplements have their role.
Yeah.
And especially if they're well studied and quality supplements that have scientific backing to them. So supplements have their space, but it has to be healthy lifestyle first, and healthy lifestyle, food and exercise. So food is got to be healthy food, the right amounts of calories, and food, of course, is quality and quantity. So food first, then supplements. Yeah, so yes, supplements have their role, but they also have to be prescribed by experts. Yeah, unfortunately, we don't have a lot of in our hospitals. You go to other countries, yes, you come out of a checkup, you're seen by your cardiologist, your diabetologist, as well as your homeopathic specialists. Here we don't have a lot of that. Luckily, we have good stores where you can go and get advice on the right supplement for you. So yes, they have a role, but the primary thing should be the diet, the lifestyle. If you're smoking, stop smoking. Before you take a supplement, stop smoking, quit drinking, exercise before you consider that supplement. So it's an add-on after all the basics have been ticked.
Okay.
Yeah.
And I think the with regards to food and nutrition, the rule that I like to use is if it doesn't come in packaging that has a bunch of ingredients that are too difficult to pronounce, then it's probably good for you. That's usually the rule that or essentially eating meals with single ingredient foods. So essentially you have some good lean beef with a small portion of rice and a large portion of vegetables, for example. A meal like that is much better versus eating processed food or a lot of fried food. And if your diet is balanced, you don't need many supplements because what the supplements are providing is what we should essentially be getting from our food. Yeah.
But I like what Doc has said. You don't need as many. Yeah. So you do require some, but not as many. As long as your food is balanced, it should provide you with everything. So what you're making up for is maybe with soil degradation over time. So the spinach might not contain what it contained 50 years ago. So that might be provided for by a supplement. So supplements are not to are not alternatives to a good meal. They supplement a good meal, but we tend to overdo.
It's not an alternative to a good meal. It supplements the good meal. Oh, that's a good one. I think another issue that faces a lot of us men, that's rarely talked about because I think of the embarrassment and stigma it carries, is sexual health. So how do we look at erectile dysfunction as a signal and not a bedroom issue?
I think I'll just go back to what I said about mental health. Over 90% of all sexual health issues are psychological. So again, talking about it with your doctor, and also maybe here a challenge to the doctors, initiating the conversation. Because again, many men come to the hospital with the intention of mentioning their sexual health issues, but they should maybe after they assess the doctor who is in front of them, they decide whether or not to share. So many times they, if they decide they're not comfortable with the doctor, then they just beat about the bush and maybe go to another doctor. So it's two-way. I'd encourage the men to, yes, seek help when you have such issues. They're usually a symptom of something else bigger. In this case, an emotional breakdown somewhere, some psychological problem, something eating you in the subconscious, and it needs therapy. You need psychotherapy for that. You need family therapy for that, couple therapy, all those things. So, yeah, and many times after you go through successful therapy, problems correct themselves without any intervention. A few times, of course, there's a medical issue like blood vessel. Like blockages of blood vessels, injuries to the spine, neuropathy, maybe testosterone issues. So there are those few that are due to an organic problem, but majority is psychological. So let's not shy away from going to our therapists. And then for doctors, and initiating the conversation, and then it will be readily volunteered by the patient.
Yeah.
And I think this is, with regards to sexual health issues, this is one area where, once again, women do much better than men, in the sense that a woman goes to see her obs-gyne from a very, very early age. And as a result of that, they build very long-lasting relationships with their obs-gynes, such that if there's anything regarding their sexual or reproductive health, they're very comfortable just going to see their obs-gyne. But sometimes with us men, we think the only time to go and see a urologist is only if the prostate has an issue. But urologists are the doctors for the sexual and reproductive health for men as well. And in the same vein, it is very important that, as Doc mentioned, that because a lot of the times what will happen is people with erectile dysfunction will end up going to see a doctor, and then they'll get referred to for some kind of psychological help to deal with that. And so what I would actually encourage men to do is to develop a relationship from a much younger age with a urologist. It's just very important just to take charge of your sexual and reproductive health, and not to shy away from dealing with these issues. Yeah.
And maybe just to add, we have a good mix of urologists at the current hospital, and yes, there are solutions which can be offered even to patients with spinal injury, because that's one of the very challenging aspects of dealing with spinal injury. Number one, you might be on a wheelchair. You didn't choose to be on a wheelchair, but you find yourself on a wheelchair, and that becomes so sexual health becomes the list of your worries at that time. You cannot walk, you need a wheelchair. So adjusting to the wheelchair, and also, many times people focus a lot of their emotional adjustment to just accepting that they're on a wheelchair, that they don't even now think about sexual challenges that come with spinal injury. Yes, so at current hospitals, we have urologists who have solutions to that, of course, through special devices. And it would also be a call for if there are people who might be listening or who might know people who might benefit from that information. Yes, those are things that can be offered. Of course, they come at a cost, but it's good to know there's a solution.
Yeah.
Yeah.
You mentioned testosterone. Yeah. So what's the myth? What's the medicine? And when do men test first?
So testosterone is a very important hormone. It's essentially the hormone that makes men men. So usually, it's interesting because I've read a couple of studies that has said the baseline levels of testosterone in men now have actually been declining versus like 50 years ago. But the major thing is to notice when a decline in testosterone levels start to cause physical symptoms or also psychological symptoms as well. For the most part, once again, that magical, okay, it's not a magical age, but from 40,
Yeah.
that's when we slowly start seeing a decline in men's just natural testosterone levels, of which at that point, if the decline in those testosterone levels cause significant symptoms such as reduced motivation, reduced libido, symptoms suggestive of depression, reduced energy, then it's actually erectile dysfunction, as we were just having a conversation about that.
Yeah.
It's actually then very important to actually then go ahead and check those levels. And one interesting thing is that sometimes when it comes to certain mental health diagnoses, what we usually try to do is we try to make sure that there isn't something happening in the body that might be responsible for somebody's mental health issues. And so a lot of the times we'll screen for different conditions to make sure that those conditions themselves aren't causing the depression. And so it is entirely possible that sometimes for example, middle-aged men, some of their depressive symptoms, their erectile dysfunction, might actually be linked to their testosterone levels. So that's when it would be very important to actually have them checked out. Yes.
And also to remember that even sexual health in this case is the least of your worries if you have low testosterone, because it also comes with cardiovascular risks. It comes with weakness, weakening your muscle, weakening your bone, basically your metabolism. So it's important to know that the testosterone levels, what if you suspect them. Maybe a challenge to us healthcare practitioners also to screen for low testosterone levels, because unlike the women where when their bodies cease to produce their sexual hormones, it's so dramatic because then all of a sudden that shuts down and you start getting symptoms, hot flashes and mood swings and everything. So for ladies, it's very dramatic. It's sort of like your hormones are here, then all of a sudden they crash. So it's noticeable. For men, it's like this. So unlike menopause, which is menopause, it pauses immediately. Andropause is a slow decline. So catching it is very tricky.
Yeah.
So again, screening becomes sometimes the only tool for us to pick those who may have it. A few times you're lucky, as Doc said, you can get symptoms that can make you suspect. So it's something that probably has to be, it's something maybe we can institutionalize and say beyond a certain age, whether that cutoff is 60 years or 70 years or whatever, to screen. Otherwise, we miss a lot of these things, and maybe it contributes to some of the cardiovascular morbidity and mortality that we see.
I think you said a drop in it can lead to a lot of young men feeling, depressed or anything. How do you also differentiate between now depression and burnout? Because I think a lot of people they're not, that's another thing that there's a very thin line between, where we're not able to tell which one is going through. Yeah.
So that's a very interesting question, because I think, especially as doctors,
Yeah.
that is something that we actually have to deal with quite a bit. Be it either or, depression or burnout, especially for us as healthcare workers. So I'd say the major difference is that burnout is essentially a state of mind that occurs after a prolonged period of high intensity stress, essentially. Either you've been working very hard on something for a very long period of time, or in a short amount of time you've had to endure something extremely stressful. And so as a result of that, that kind of burnout is almost like a way in which the mind is trying to reset itself. And I think the phrase in and of itself is quite interesting. You've burned out. The fuel that was there, you've used it all. And so you need to recover from it. Versus depression, which is a psychiatric condition, in which the major difference between burnout and depression is that after a period of rest or removing yourself from what was stressing you for a good period of time, the symptoms of burnout they resolve. Whereas with depression is they continue, is the thing. And depression and the issue is that depression tends to cause a lot more, let's say, occupational dysfunction, in the sense that depression will affect your ability to do a lot of your daily activities, essentially. When you're burnt out, you might be cynical, you might, have a little bit of low energy, but you can still recognize, okay, it's still important that I go to work today. I might take things a little bit easier. But when you're depressed, you'll find it's hard to get out of bed. You might not want to shower. You might not want to see any of your friends. You don't want to talk to people.
Yeah.
And the symptoms of depression, a lot of the times with depression, it can feel like it's never going to go away. And that's a major difference between burnout and depression.
And depression is a well-defined clinical entity. You must satisfy a certain criteria that has been set about their symptoms that we look out for, and those symptoms have to be there for a certain duration for you to say it's depression, or it's a depressive episode, or it's bipolar disease, or so it's a well-defined clinical entity where there are symptoms like hallucinations, delusions, unkempt behavior. Unkemptness. Patients might have abnormal behavior, like withdrawal. You look into the future and there's hopelessness. You can see tomorrow. There is weight loss or weight gain, depending on whether people eat or deprive themselves of eating once they are depressed. Things like suicidal ideation. So there are clinically defined symptoms that we look for. And they have to be present for a certain duration of time before someone can be labeled as depressed.
Yeah. You mentioned earlier in this conversation something about emotions and us men, Doc. And to you, now that you've seen both sides of the spectrum, what does emotional fitness look like?
Excellent. I would say emotional fitness. I would say somebody who's emotionally fit is somebody who's aware of their emotions, the whole spectrum of their emotions, both negative and positive. Someone who understands, who is able to label, because if you don't know your emotions, then there's no way you can label them. Someone who understands anger and what underlines anger. Anger is not an emotion per se, but there are emotions that underlie that anger. what brings about those emotions, what brings about the anger, how do you express the anger. So someone who knows that emotions, yes, are part of life, but we must be able to adapt to those emotions, not make them and not become slaves to our negative emotions, but rather know how to manage them in a healthy manner. You cannot begin that journey unless you know. So I think ignorance here is the biggest gap, is really the biggest factor, that we don't know that we're emotional people, and that our emotions can get in the way of relationships, and that dealing with those emotions and addressing them in a healthy manner can be both advantageous to you and to the people you relate to.
Yeah.
Yeah.
And I think also we need to remove this idea that being emotional is something which is very negative, in the sense that it's being human is a very emotional experience, and if we don't learn how exactly to deal with those emotions when they come, because I think emotions give us very, very great information about what's currently happening, and they're there for a purpose. I think, for example, like if somebody learns how to use their anger and channel it in a more productive manner, it can actually allow them to get positive things done. If somebody learns to figure out what their sadness is telling them about their life and what they can change about what's going on in their life, once again, it can be a means for positive action. And I think with regards to emotional fitness, I think one interesting thing, or one way in which I look at it, is that to become emotionally fit, you have to get stronger. The things that used to, if something upset me today, if in 2-3 months time that same thing still upsets me, then there's work that I need to do. And as humans, we should grow in our capacity to deal with more complex situations without our emotions essentially becoming something that gets in the way of that. Yeah.
Exactly. Just to add on to that, I think that's a fantastic way to put it. If you look at, imagine yourself as, because I think we always exist in two states. You're one body, you're one person, but I visualize it like you're existing in two different states. There is a perfect you. Probably, for you, there's potential for that good person who will go to heaven if you believe in, if you're a Christian.
Yeah.
And in the same person exists another person who will go to hell. Think about like the Schrodinger's cat. So the cat exists in two states. That's quantum mechanics now, quantum physics. So you exist in two states. There is a perfect you,
Yeah.
and there's a good you and there's a bad you. So emotions sort of are signals to tell you what state you are in at every moment in time. Are you the good person you would be? Are you that man you would be proud to be? Or are you that other person who you're not proud to be? Are you that man who your wife wants you to be, your children want you to be, your colleagues want you to be? Or are you that man who your wife is stressed about? Because it's the same man, but you choose to be either this man or this other man. If someone cuts you off in traffic, what happened? You get angry immediately because I'm a kudarau, so that's the source of your anger. But it means there's some things you're dealing with that you need to deal with. Why should you become angry if someone cuts you off in traffic? So how we respond to that is a totally different thing altogether. So being that man that you would be proud to be. Now emotions are just signals to tell you I'm existing at this point as this person. So I need to do something. This is not me. I need to go back and switch to be this other person I would be proud to be.
Yeah.
Yeah.
Actually, one of my mentors, that's exactly what he told me. He told me that emotions is like sensitivity. And sometimes some people say they're more emotional. It just means they're more sensitive to how the things around them or within them is making them feel. So sometimes, even as a man, I think sometimes we have that thing for where we say being too emotional is a bad thing. But it's like sometimes it's not a bad thing. It just means you're more sensitive to the things happening outside of you and within you as well. Yeah, but I know we had moved away from the conversation on sexual health in men, but someone has posed for us a question, and the question is, what's the relationship between erectile dysfunction and infertility?
So that's a very good question. So a lot of the times, what can happen is that some of the conditions which do cause erectile dysfunction can also cause infertility.
Okay.
But the issue or the way those two go together is that if the if an if an erection is not of suitable quality in order to actually have intercourse, then you can't get anybody pregnant. Is the thing. I think that's
But that's just it. You may have
Yeah.
the right amount of sperm, and that is defined. There's a normal range. You may have the right quality of sperm, because again, you can have sperm, but it doesn't swim. That's another cause of infertility. So you may have the right sperm, you may have the right quality of sperm, right quality, quantity, and the sperm might be projected in the right way, because again, we have conditions where sperm is ejected backwards into the bladder. So you may have all those going for you, but if you cannot erect, then obviously there cannot be penetration, there cannot be fertilization. So that in itself is a cause of infertility in that sense. But it's an easy one to deal with, because as soon as you can handle the erection problem, then everything else is ready for fertilization to occur. What is more challenging is if you don't have sperm, number one. You have an erection, but you don't have sperm. Or that's a bit difficult to deal with. Or you have an erection and you have poor quality sperm, So, or you are ejecting backwards instead of forwards. So those are other aspects of infertility that might be a bit more challenging to deal with than an erection. Erectile dysfunction can, I think, because as I've said, 90% of the cases it's down to an emotional issue that can be easily addressed. And even when it's not an emotional issue, many times it's possible to beat the system even by using devices, as I've said. If it's a hormonal challenge, then hormones can be supplemented.
Okay. Now to family, something that, and relationships that play a key part in the quality of our lives as men, So how much does family and relationship affect a man's health and lifespan?
Look, you're still single.
Yeah, so
So I guess that's more. Anyway, feel free to contribute.
I think that with regards to the family aspect of things, you can answer that question. But at least from as still a single man, I think the one thing which I do notice is that I think relationships, women are very health conscious is the thing, and women help men bring out certain aspects of themselves which without their presence the man might not be so aware of that. And so a very healthy relationship is something which it enhances not only physical health but emotional as well as psychological health, because a relationship can become a great support system to go through life. No matter how well you handle yourself, you make all of the right decisions and choices in life. Life throws all sorts of chaos at us, and a very strong relationship is something which can help us buffer or get through those difficult moments. The major thing, at least, which I am noticing is in this modern day, is that I think women are requiring men to be a lot more emotionally intelligent now, where because that aspect of because ladies are now in the workplace, they're running businesses, they're doing very well for themselves. So that aspect of being the provider per se is not, it's still there, yes, but it's not as critical in terms of entering a relationship. And so now the challenge that's being posed to a lot of men is now being a lot more emotionally aware, emotionally intelligent, emotionally available in order to create a very healthy relationship with ladies. So that's just my perspective of things as a single man. But
Let's hear the married man.
Yes.
Yeah, and okay, and once you get married, yes, it's also important. As much as your wife
Happy life, happy wife. I mean,
might,
happy
might,
wife,
might be
happy
earning
life.
more than you, she still expects you to provide for her.
Yes.
Because, I mean, that's how she's wired. You're her provider, you're her protector, you're her, you have to be emotionally available, yes, you have to be available. She has to be 100%. Yeah, I mean, you have to be there for her, available to her 100% of the time. So yes, she's in the workplace. Yes, she might even be your boss, but she still needs you to buy her, to take her out and foot the bill. And I think it's a nice thing. And most women are you know, they appreciate that. Yes, as much as she's a millionaire and you're a pauper, but you can still show that you can still show leadership, take initiative.
Yes.
You know, buy her gifts. You know, not once a year, all the time. If she loves flowers, buy her flowers. So as much as you know, you do be seen to be doing what a man ideally, the role a man should play in the family.
Yes.
Yes, so that's important. It's extremely important. I mean, as a happy wife, yes, can a happy marriage. That is scientifically proven. You live longer. You have a longer life, happier life. But it's a double-edged sword. If if it's a bad marriage, then you die very fast. So it can go either. It can cut either way. So we really, before, this is really an advice I'd give to men before deciding to get married. You have to really you really have to know and understand what your role is, what your purpose is, number one. Because many times we get into a relationship with zero knowledge of how marriage works, how, you know, we bring into marriage our flaws and lots of baggage that we don't deal with. I think dating should be at that time when you bring all this baggage from the past, including your sexual addictions, if they are there. Bring them there. I mean, you're not married, you're dating. Discuss them. Can you deal with this? Yes, I have, or I've had sexual addiction. I've had a 50 girlfriends in the last, you know, yeah. But, and I've gone for therapy, or I'm going for therapy. Then she can say, okay, no, I'd rather first I'll support you to go through therapy. At the point when you feel you're ready, then we can marry. So that you're not coming into marriage and bringing lots of garbage and and baggage that should have been dealt with before you got into the relationship. You're good people, but there's a there's no enough disclosure. Yeah. You can call it off if you have to. Yeah, but if you decide to go ahead with it and she feels that, yes, you've done work to, to deal with your anger issues, to deal with, sexual addiction issues, to deal with, all these things that are there, trauma. I mean, a lot of trauma that goes on from when you're a child. Maybe you are abused, maybe you were beaten, maybe you were taken to, maybe you were weaned too soon. You're not breastfed up to
6 months.
you're weaned off. I mean, a lot of traumas that we go through growing up. They catch up later, and if you don't address them before getting into a relationship, they catch up with you later. So I would say that before you commit, get to know each other so well, disclose everything, and whatever you're working on, either complete working on it before you finally commit. Now, those of us who find ourselves in it, and now we are caught by issues later on, then seek therapy, seek support. There are people who are qualified to guide you through such challenges.
Yeah.
Seek therapy. If your marriage has got an issue, if your wife is not happy, she's moody all the time, there's a problem. Yeah, so address those issues.
Yeah.
And they're professionals.
I want us to do a little bit of an exercise. So it's about 5 questions to bust some myths. Yeah. So myth number 1, I am slim and I run. I'm at low risk of heart disease. True or false?
It depends.
Yeah.
You can be running, but you're smoking 2 packs of cigarettes a day.
Yeah.
Yeah. So if you're slim and you run and your diet is good, you don't have a family history of heart disease, then yes, you'd be at a rather low risk of heart disease. But if you just run but you go home, you eat, I don't know, fried chicken and burgers and fries and all of that stuff, you smoke, your job is stressful, you're sleeping at 2 a.m., then no. It wouldn't make much of a difference.
And some of the people I've seen with the highest levels of cholesterol was slim people.
Okay.
Yeah. So run. So in general, after considering all sides, I think the message to the people should be, no, you're not healthy. We need to qualify that by making sure that what Daktari has said, your lifestyle is good, you're running, you are eating right, you don't have bad habits, but also you've gone for your annual checkup and your cholesterols are fine, your sugar is fine. Yeah.
Okay. The next one. My dad had prostate cancer, so it's inevitable for me. True or false?
False. But they haven't said that. Again, almost every man, if you're long enough, you'll get prostate cancer. Okay. Whether your dad had it or not, you live long enough, 80% of the men will get prostate cancer. So it's something we share as all men.
Yeah.
Yeah.
Another one. I don't need to check my liver. Herbal cleanses detox my liver.
So we need to dispel this myth about different cleanses and detoxes, and the body naturally detoxifies itself.
Yeah.
As long as, even when you put in toxins, as long as it doesn't overwhelm the body's capacity to detoxify those toxins, then all these detox teas and juice cleanses, you don't really need them.
Okay.
And from experience, I've lost 2 patients from detox. One when I was doing my postgraduate, the other one when I was practicing, and managed to treat others, lots of others who did not get very sick to get to that point of unfortunately losing their lives. So yes, you don't need to detox. Your body already detoxifies itself. The liver, that's the job of the liver.
Yeah. Finally, testosterone therapy will fix my low energy.
No, because if it is because of testosterone being low, if your low energy is not because of testosterone being low, then there's no way getting more testosterone will fix the problem. Yeah. But if your low energy is due to low testosterone, then yes, testosterone therapy will fix your low energy, and we have seen it. But then again, you need to be cautious. You just can't gobble it like that. It needs to be properly prescribed and followed up, because it can also come with its challenges.
Yes.
Yeah.
Okay. I think as we wrap up, we're coming to the last few questions of the day. What's one personal lifestyle change that you've made that has changed your health?
For me, that's a very simple answer, is going to the gym.
Yeah.
Going to the gym. I go to the gym at minimum at least 4 times a week.
Yeah.
At most around 6 times in a week. And for me, the gym, I don't know if you've heard of gym therapy per se,
Yeah.
but there's something about rigorous physical exertion that helps the mind to deal with especially psychological issues. It's not a replacement for conventional therapy and counseling. But I found that as a result of just subjecting myself to the daily discomfort of lifting very heavy weights, it's allowed me to become more emotionally and psychologically resilient. And especially because being a sorry about that. being a doctor is a very it's a very emotionally draining and even at times psychologically traumatic job, because we see people in all sorts of different conditions. From happy moments to watching babies get born, all the way to sad moments such as losing a patient and having to counsel a family. And I found, at least for me, the gym really helps me decompress from the full spectrum of emotions that I experience while practicing medicine.
Okay. What about you, Doc?
Excellent. Yeah, for me, I'd have to say walking.
Yeah.
I've introduced more walking to my schedule whenever I can. Unfortunately, I mean, when you have to drop your kids to school, you're forced to drive. But when, like during holidays, when I don't have to drive, I actually prefer to walk and catch a matatu to work rather than, to drive myself to work. And that, I've seen it, I've lost weight that way. Of course, cutting sugar, which is another thing that we don't need sugar. Processed sugar. I mean, sugar is a processed food. So if you can cut sugar in your diet, amongst other healthy things, walking has really helped me. And it also helps you both physically and emotionally. Yeah, interacting with nature. And I happen to walk at other times when you're lucky, you see zebras, and that's my neighborhood. Zebras, gazelles. So it's therapeutic, and it's really nice interacting with nature that way.
All right.
Wait,
Sorry.
Sorry. What about you? Have you added any really healthy habits that have really made a difference for you?
Yeah. Fasting. Time eating. Yeah.
Intermittent fasting. Yeah, that's the thing.
Time. So between 9 to 7, I don't eat. Yeah. It's weird because I feel like I'm more energized. Before, if there's one thing I used to love was after the office, taking that nap. Wow. I used to love that. I don't feel that anymore, So it was kind of weird that I've eaten less, but seem to have more energy. And then, of course, lost maybe like about 9 to 10 kgs.
Oh wow!
Yeah, so that I've seen. But that's physical. Mental, of course, is journaling. I write all the time, how I feel, good day, bad day, stressed day, Yeah. What do men never ask you, but definitely should? That's actually I want to hear your answer, because I might have not asked you that, and I've spent almost 3 hours with you now.
Yeah.
You want to take that question,
No,
Doc?
to me, it's about sexual health and emotional health.
Yeah.
And yet, if you just take time to prod a bit, you find that these things are there. And I love it, especially at times when you start a conversation and you end up with the client in tears because they've just begun their healing journey. And many times it's not because they have told you, it's because you've prodded. And actually, part of our training, when we are taking a history, part of our history taking, you have to do something we call a systemic review. Systemic review is where you ask a patient from head to toe anything that could be affecting them. And unfortunately, many of us never do exactly that all the time with everybody. Because if you did that, if you took a proper history, you would pick all these things: erectile dysfunction, psychological issues. Yeah, but for those doctors who consistently take a good history and go through a systemic review, and that is something which the patient didn't come complaining of. You may have come with a tummy ache, but in a systemic review, I'm supposed to ask about how is your sleep, do you get headaches, do you get what? And many times we end up picking things in the systemic review that are relevant that the patient never complained of. So that's again a challenge to the doctors. As you're seeing your patients, let's just do a good job and ask about all those things we are trained to ask about. And many times we can pick up these challenges. Yeah, but if we wait for the patients to volunteer, maybe 1 out of 100. Yeah, so I guess that's more of a duty to the doctors than to the patient, but also to encourage the patients to, ask these things. They are difficult, but as we said, jishinde ushinde. If you're not ready to overcome your fears, then you're not going to win.
I think in a similar vein to what Dr. Musila has said, I think I'd probably say one thing which I wish a lot more men would ask is how can I reduce consumption of my vices is something. How can I reduce how much alcohol I'm taking? How can I reduce how many cigarettes I'm smoking? And I think in asking that, as Doc has just said, we'd probably uncover a lot of different things that are actually happening. Find out that okay, the alcohol consumption is because they're working an extremely stressful job, and so they take alcohol to cope with it.
Yeah.
And then now we can figure out, okay, what can we do besides from the alcohol to cope with how stressful the job is? And then it will open up a whole bunch of different avenues to enable us to provide the tools and the support for them to avoid the complications that excessive alcohol consumption, for example, would bring.
So that's a real courage. Facing your fears, overcoming that addiction to alcohol. That's a real courage. Overcoming that addiction to sex. That's a real courage. Overcoming that addiction to, just being able to wake up an hour earlier to either read, exercise, meditate, journal, that is the real courage. Overcoming that, urge to eat junk that's a real courage. Overcoming that fear to fix broken relationships, that is a real courage.
Yeah.
So if we can look at it that way and be intentional about living, we can get somewhere.
Yeah. Is masturbation healthy or unhealthy?
Medically speaking, there's nothing wrong with masturbation, but that is medically speaking. Psychologically speaking, it's spiritually speaking, it is wrong. Psychologically speaking, if it probably at some point, at some age group, it probably is acceptable. Beyond a certain age group, it becomes maladaptive behavior. Yeah. So the same way we can say we can discuss sex even in teenagers and everything, and the world will tell us it's okay. But in our country, number one, legally is wrong. And as much as what we see out there on social media, in movies, it might make us feel as though it is right, but it is wrong. Yeah, I still believe it is good to save yourself for the right partner at the right time. Yeah, but that is not the conventional wisdom. But that is that is wisdom that I subscribe to. Yeah. So masturbation. I mean, if you're an adult and are still masturbating, I think that is wrong, and I don't think it's healthy. I think it's a form of sexual addiction, and I think that can cause problems if you're married in your marriage. It can cause problems with if you have a girlfriend or a boyfriend. It can cause problems in the relationship. Yeah, so I would choose to say that it's not a healthy thing. If for a teenagers growing up, probably is okay, but if it persists, then it's not okay. But other people may have a different opinion, but that's my personal opinion.
I think I agree with Doc that if we put morals aside, physically, it doesn't really have much of an impact on the body as long as it's not done in an overly compulsive manner. But then spiritually and morally, those are now questions which the individual is going to have to juggle with. There's some people who think it's not so bad as long as it's done in moderation and as long as it doesn't impact their relationships or even their work. Because there's some people who it can become compulsive, such that it's interfering with their work, with their relationships. That's when it becomes a very major problem.
Yeah.
Yeah, and even in terms of mental health and sexual health, yes, I think some sexual health specialists would agree that it can contribute to things like, for example, not erectile dysfunction per se, but premature ejaculation. So that is medically proven. Yeah, so yes, it can actually have some sexual consequences, but in terms of causing other health issues, no. But yes, overall, it's not healthy.
Okay. Finally, if you were to create a rule book or a blueprint for men in regards to health, what are 3 rules that you're having on that rule book or the blueprint?
That's a very good question. For me, I think number one is exercise.
Okay.
I think it is very important that men are physically strong.
Yeah.
So I would put exercise, so either some kind of aerobic activity or some kind of resistance training, or even things like swimming, running, etc. Then number 2, I'd say is to eat healthy. So a relatively high, as long as there are no medical conditions that would affect this, a relatively high protein diet with reduced minimum or reducing the amount of refined carbs, especially. And then after that is to engage in activities that pushes them to develop themselves in a holistic manner. Be it something that engages their intellectual capacities or their spiritual capacities, something which keeps them ambitious and driven. I'd say those 3 things is a recipe for a very healthy, high performing man.
For me, I'd say, why am I know the role I have as a doctor: keep you healthy, keep you alive as much, or that to the extent that I'm enabled to. We don't heal as doctors, of course, but we are grateful that we are given an opportunity to be able to help people live longer, wherever we can. We're not able to succeed all the time.
Yeah.
So my role is to help you live healthy, live longer, give you a second chance in life. That's my role. So I would say in my rule book, number 1, see your doctor. you will live healthier, you will live longer from all the advice, from all the follow-ups, from addressing issues as they come.
Yeah.
But then again, where are you living? Why should I fix your heart when you come with a heart attack? Why should I save your life when you come with a stroke? Why should I intervene in an emergency situation, make sure you walk again? Why? So now you have a higher purpose,
Yeah.
whatever it is. So that purpose, you must take care of that. You must know your higher purpose. You must know your calling, whether it's spiritual, whether it is whatever it is. You must understand your purpose, so that you're saying, I need these days, I need to recover from this bed so that I can get back to doing 1, 2, 3 because it is serving, because that's my purpose on this world. And when that purpose is achieved, then you can die peacefully. So you need to know your purpose as a man from a spiritual perspective, and of course, that's the greatest purpose that we all have. So spiritual fitness needs to be, to me, is the most important.
Yeah.
In between spiritual fitness and physical fitness is the mind.
Yeah.
Your mind needs to be in the right state for you to achieve your purpose.
Yeah.
So for me, I believe I'm at the lowest of, as doctors, we really are at the lowest. We are the what from corner, we keep you alive.
Yeah.
For you to figure out what you need to do and achieve that greater purpose. And to do that, you need to be in a right state of mind. So again, seeing your mental health doctor, or you're reading books to enhance your mental health, or getting mentorship, or getting all this is really the second tier. So there's a doctor, see your doctor. Number 2, see your therapist. Number 3, take care of your spiritual.
Yeah.
Yeah, so those 3 things are key.
All right. Yeah. I think as we wrap this up, any final words for the audience?
I think what the main thing I'll just say is as men, one of the things we really need to improve on is what we call our health-seeking behavior. And that's simply when we feel that something unusual is going on in our body, we just go to the hospital and get a checkup. And once again, to compare us to the ladies have amazing health-seeking behavior. And this is simply because a lot of health checkups are intertwined into their daily life. So, for example, going to see their obs-gyn on a regular basis. Then when they have kids, they'll go to see the pediatrician to check to ensure their kids are developing and growing well. And then they'll just be like, you know what, let me go see my GP or something while I'm here.
Yeah.
So for us men, just to simply, when we feel something unusual is going on, we just go to the hospital and just get a checkup and understand that hospitals and doctors and healthcare workers are there to keep us healthy so that we can continue to thrive in our lives. Those would be my parting words.
Okay.
So yeah, and just to underscore what Doc has said, for ladies, they being in a hospital even when they are not sick, just because they are pregnant or they're taking a baby to the clinic, so just being in that environment and getting all those tetanus jabs, it translates to protection against tetanus later on. For example, of all the people who die out of tetanus, probably 1 out of 20 is a woman. 19 out of 10 are men. So tetanus rarely kills women. Why? Simply because they have to go to the hospital when they're pregnant, they have to get tetanus jabs, they have to get this and that. Men, because we don't go to the hospital. And that's just tetanus. So think about hypertension. These ladies their blood pressures will be taken when they're going through the clinics. Their sugar levels will be tested. So they are more aware and they're more readily, they more readily volunteer to go to the hospital. So men should copy women in that sense and go to the hospital even when you're not sick. Go to a therapist even when you don't have depression. And of course, make sure your spiritual health is on top.
Yeah.
Yeah.
Doc, thank you so much, for gracing this channel. Thank you so much for accepting the invite. not only to speak on this channel, but to speak at the upcoming men's conference. We really look forward to you guys, sharing a lot more wisdom and knowledge. Yes, thank you. I really appreciate it.
Shukran.
Yes. For those of you tuning in from home and for those of you listening, please remember that this November is all about you. You've heard from the two doctors how important it is to get checked. Get your prostate checked, get your heart checked, and do all the other free tests that you need to do this November. New you, new year. So go into the new year knowing exactly what your health status looks like. You know what? Thank you for tuning in to another episode of the Just to Kick It is a Blessing podcast. Remember that no matter where you are, no matter what you are going through, Just to Kick It is truly a blessing. Goodbye and see you next week. If a hater come, we are let him stay. If a demon come for the boom, I ain't singing. No weapon forming against me shall prosper.